Welcome to this session this afternoon. You have to honestly be the most scary looking audience I think any of us have ever faced. Anyway, this session this afternoon is about talent entering the industry. Now, we have a very, very prestigious panel today. Starting on my left, we have Shafi Ahmed, David Hunt, Alex Telfer, Dr. Jack Kreindler, and Mr. Marc Koska. Now, I'm going to ask you, starting with you, Shafi, to give a few words about, your background, what you do.
Cool. So I'm Shafi Ahmed. I'm a surgeon. I'm a cancer specialist working at the Royal London Hospital and Barts Health NHS Trust. That's my day job. I have other jobs that I juggle around with. I run a couple of tech companies. I do a lot of work in VR and AR. And I'm also an associate dean at a medical school, so teaching, training, and run some tech companies, innovation work. That's been my interest. And I do a lot of global work about how we make healthcare more equitable in terms of teaching and training. That's, I guess, my spiel.
David, on to you, please.
Yeah, so I began by doing work experience, as I'm sure a few people here know. My first kind of job was to go and get the sandwiches, which included getting the burgers from Burger King and the fries from McDonald's. From those first few days as doing work experience at what was Creative Links, I then progressed through the organisation. I was part of a management buyout team in 2008. We joined Havas in 2012 and I became the CEO in 2013. Havas has gone on to be the healthcare communications agency in Europe, and I enjoy my job every day.
Excellent. Now on to a very, very, very talented photographer, Alex Telfer.
Well, I'm an advertising photographer and director, and I guess one of the reasons I got into it in the first instance was that I was always quite a creative person, and what I found was it just was really suited to my ability to basically create work for commercial sense often. Over the past few years, probably the past 10 years, I slowly started migrating into pharmaceutical work as well as consumer. And I've really enjoyed it, and I've enjoyed the challenges that's brought for me.
On to you, Dr. Jack.
Yeah, so I'm Jack. I studied at UCL Medical School, qualified back in '98, and progressed through emergency medicine and then high altitude physiology and extreme conditions medicine, all along the way, paying my way through medical school and school, doing IT stuff, because big organisations with lots of money paid small people like me who thought they knew about computers to do consulting work, so that's how I got into it. And so I've had a parallel career in information technology, computer science and artificial intelligence along with my medical career. And I now kind of split my time really between practicing medicine, inventing stuff, which is sort of new in the health tech space, specifically around the use of new data sources and the use of machine learning to help doctors and patients make better earlier decisions. Most of that stuff is based in my startups in California, and the other third of my time is spent in the creative sphere, trying to get those innovations into practice, which is kind of where I've landed, and where I'm now enjoying a third of my time after that chap over there convinced me that this would be a good home for my creative talents. So yeah, and loving every minute of it.
Excellent. Now on to, last but by certainly no means least, Mr. Marc Koska.
Well, thanks for letting me follow Jack. That's really helpful. So I started off, I didn't go to university because I couldn't find anywhere that would deliver the course that I really was dying to do, that I really wanted to do. So I went traveling, I ended up in the Caribbean, got a job making models of murder scenes. Some of the victims look like you guys out there, and which was a fantastic job. It was 1983, 84, no CAD or computers or anything. So I had to make architectural models and take them into court to show the jury how the murder took place. And in that time, also HIV was getting a lot of press and traction in the American media, and that made me to start looking at the subject that I went on to do, which was design a syringe to stop the spread of AIDS by the reuse of syringes, and not just AIDS, but hepatitis and other viruses. We've been dominating the UNICEF market with this design. It's called K1, and now I've moved on to do another system called Appiject, and it's a way of not only giving safer injections, but also transporting the vaccines and drugs in a much more environmentally and compact and robust way. So very excited about my new startup.
Well, ladies and gentlemen, a round of applause for our panel, please. Right, now the purpose of this particular event is for you guys to ask these guys some questions. And the first question, if you'd like to stand up if it's your question, is from Annabelle Evans.
My question is for Alex and David. I was just wondering, what words of advice would you give to someone who's starting out in the industry?
Well, I mean, from my point of view, I think, there's a lot of people trying to get into this industry. I think, you've got to try and set yourself apart. I think you must be passionate about it. I think you've got to be driven and absolutely driven to the point where it probably sort of consumes quite a lot of your life, to be honest.
David, your view, please.
So I think one thing is about passion, and it's making sure you're really passionate from a healthcare point of view in terms of improving lives. And I think if you're committed and you're passionate and you're enthusiastic, then you're going to deliver your best work, and then you'll be successful. But the other thing that I think is really important is it's also about recognising your strengths, but also being respectful. And respectful that you don't necessarily know everything there is to know about the industry. We're very talented and we're very good, but we are still going to keep learning. What I would say is, while we're going to keep learning, we're going to keep getting better, let's not forget that spark of brilliance that's going to really disrupt the industry and challenge the industry and move away from the status quo. So I think it's a fine balance between respecting people around you, but continuing to kind of push boundaries and staying true to yourself.
Thanks very much, Dave. Next question is from Ella Cooper.
It's great makeup.
It is. It's fantastic.
Dr. Jack, my question's for you. When have you felt that during your career in healthcare so far that you've truly made a difference to an individual's life?
I'm going to try and be quick. It's not an easy answer. There are really literally countless numbers of times where you can make an individual's life better. And I mean, there are tons of examples, and I just basically see this as what I'm supposed to do rather than anything particularly glorious. But there are 8,765 hours or something in the year. We can make a massive difference to many, many, many more people's lives than just the few hundred that you can individually do your hero stuff with. Okay? It's not as direct, but it's a hell of a lot more direct than it used to be. There is no way that 10 years ago you would know and see and feel and enjoy the feedback that you could get from individual people who've been touched by a campaign or by a new breakthrough or something because of connectivity and social media. And you can actually get that feedback, that same sort of feedback that I might get if I can individually help somebody, but you can get that all the time for many, many, many more orders of magnitude of people than an individual doctor can get in their careers. So, it's an amazing time to be in healthcare and to be in that area of healthcare where you're affecting more than just individuals.
Many thanks for that, Jack. Right, moving swiftly on to the next question, which is from Georgina Price, please.
Hi, my question is to Marc and Shafi. What risks did you take along the way?
Probably all of them, anything you can imagine. And what came to mind was one day I was speaking at a conference in Brussels, and there were about 2,000 people in the audience, and I showed this film of a syringe being reused a number of times. It was an undercover film that we had. The person on the panel with me, very similar to this, was Dr. Margaret Chan, who was the head of the World Health Organization. And in the green room, a few minutes before, when I'd gone up to introduce myself to her, she had put her hand in my face. She's Hong Kong Chinese, so to put your hand in someone's face is literally the rudest insult you can give to anyone. And I'd never met her before or spoken to her. And I thought that was quite odd that she would do that to me. And 5 minutes later, we're on the stage and I show this reuse video and the audience gasped because it's pretty horrible. A baby gets injected with possibly, other viruses like HIV. And I said, does anyone want to know why this happens? And everyone in the room put up their hand. There were about 2,000 people. And so I went, it's because of murderers like her. And that was probably the biggest risk that I took, other than probably third mortgages on houses and stuff like that. because it could have ended in complete disaster. It was a bit awkward at dinner that night. But in the morning, I tracked her down at breakfast and stood over her table until she gave me an appointment. And then I raised a load of money for her, and we launched the third ever global privately sponsored legislation at WHO, and we put that through a few years later. So it was a risk worth taking, but to be honest, the words were out of my mouth before I'd even thought about it, so it was terrible.
Thank you. Shafi?
So about 2 or 3 years ago, I was doing the first live operation with Google Glass, that you might have heard about, going to the world. I've been really challenged by previous education systems and the archaic way we train medical students for many years. And I wanted to scale up, educate people at a different level. I thought I could do better. So you can imagine a scenario, me thinking about doing one case, patient on the table with cancer, it's a big operation, not straightforward. The BBC camera here, Sky camera here, reporter over there. The place was full of people in the media who were in a frenzy. And I didn't know there's a patient there whose life we had to kind of deliver, sort of thing. At the same time, the medical director was phoning up from the hospital saying, "Are you sure you want to do this? There's lots of risk involved." And there's always pressure around this one case, if you like. And I think, let's just go into my zone, forget everything else that's going around me, and I just concentrate on the operation I do every day. I've done for 20 years. I went very smoothly. I was happy with it. But if that had gone wrong, my life would have gone in a different direction, let me tell you, right? I won't be sitting here right now.
Next question comes from Yannicka Earl. Yannicka?
So I think one of the biggest risks that I've taken in my own life is moving away from architecture. I kind of changed track and went into graphic design. And this question's for Dave, but I guess anyone can chip in if they feel like it. How does the industry benefit by drawing experience from diverse backgrounds?
I am a huge advocate for diversity and multidisciplinary teams. And I get really frustrated by the industry and its use of buzzwords. And people keep talking about makers and hackers and all these different things. Despite that, they still assemble project teams that are almost identical to like a couple of years ago. There's still, the client, the brand manager, the medic, a creative and art director. There's not the diversity I want. I absolutely believe that the more different expertise that we can bring together, the more different experiences and thoughts, the better the products will be.
While we're on this question, I'll just refer to Alex. Do you think having a photographic background it's helpful to be in the photographic industry or not?
Not necessarily. I would have said, and I know when I was at college, I think a lot of the students that were on the course were quite technically useful, if you like, but that only gets you so far. I think sometimes when you view things from different angles or from different disciplines even, I think that opens up your horizons. Providing you've got the passion for it and the appetite for it, I think that's the key thing,
I think we're only probably going to have time for one more question, I'm afraid, and this comes from Chris James. Chris?
I've got a question for Dave. What do you think it is that you needed to demonstrate to rise to a senior management position at such a young age?
What I'm not allowed to say is work hard. And the reason I'm not allowed to say that because it hints at almost like a macho culture. All of that said, had I not demonstrated the passion and commitment that I had and working hard, then I definitely wouldn't have been able to rise to the top. So I think the thing that I would advise you to do is around passion, and it's around commitment, and it's around enjoying what you do, working hard, and that's genuinely how I think you can go on to be successful.
Jack?
I basically wouldn't get obsessed about the concept of senior management. I'd get really obsessed about the impact that you can have. If you can have impact and passion towards impact as your focus, income will follow, positions of responsibility will follow, accolades will follow, people will offer you jobs, you might come up with an idea and start something yourself.
Thank you very much for your fantastic contributions. Have a big round of applause for our guests.